This video is created for physiotherapy education and learning purposes only. The demonstrations and/or explanations are as per our experiences and are generalized and may not be appropriate for every patient or condition which is more specific. This content should not be used as a substitute for textbooks but just as an aid to formulate answers better.
Hello, this is Dr. Ravina here, and today we are going to discuss about overuse syndromes of the elbow. Before we proceed, let's look at the most commonly asked university paper questions. So they've asked about the management of tennis elbow for 7 marks, or they've asked about physiotherapy management of golfer's elbow for 7 marks. Occasionally, they have also asked about the diagnosis. So we will discuss both the diagnosis aspect as well as the management aspect of tennis and golfer's elbow. Let us first discuss the clinical features and the diagnosis of lateral epicondylitis, also called as tennis elbow. So looking at the clinical features, we know that there is pain and tenderness on the lateral aspect of the elbow, which is at the lateral epicondyle. That is the common origin space for the extensor tendons. So whenever there is a firm gripping activity or there is some repetitive wrist movement where the wrist is going in flexion and extension alternately and in a good amount of speed, then that can eventually lead to tennis elbow. Usually the muscle that is affected is extensor carpi radialis brevis. So if you see your anatomy, this extensor carpi radialis brevis is inserted on the third metacarpal, which is the middle finger. So because it is in the center of the wrist, whatever movements you're doing of flexion and extension, this muscle is always getting affected because it is in the center attached to the third metacarpal. So this is why in tennis elbow, the most commonly affected muscle is your extensor carpi radialis brevis. Now there are two tests which the people are performing here in the images. One is the Mills test that involves the stretching of the extensors, where he flexed the wrist first, followed by extension of the elbow, that is causing a stretch maneuver. And the other one is a Cosen's test, where the person is applying a resistance and asking the person to contract the extensors. So both the tests are symptomatic or diagnostic of tennis elbow if the pain is specifically generated around the lateral epicondyle whenever they are performing either the stretch maneuver or the contraction with resistance maneuver. Now let us look at the clinical features of medial epicondylitis, also called as golfer's elbow. So similar to lateral epicondylitis, where the pain is on the lateral aspect of the elbow, there is pain in the medial aspect of the elbow in medial epicondylitis, also called as golfer's elbow. So sometimes it can radiate on the ulnar side as well. So here the common flexor origin muscles are getting affected because flexors have their common origin at the medial epicondylitis. So tenderness is directly seen there. So whenever you are applying resistance to the wrist flexors, or if you are stretching the wrist flexors as shown in this video, if there is pain that is generated on the medial aspect of the elbow, which is at the medial epicondyle, then that suggests that the person has a golfer's elbow. Now, whenever we discussed about PT management, I always remember my teachers during those days always emphasizing on these 3 points, which I always carry with me. Which is, first, when we decide the PT management, we should first look at the source of symptoms which is causing the pain or the swelling or whatever. So you have to tackle the source. We have to look at the stage of tissue healing, whether the person is in acute stage, whether the person is in subacute stage, or the person is in chronic stage, because accordingly your management will vary. And finally, we have to talk about the dominant pain mechanisms which are there in that person that helps us determine the kind of PT management that the person will undergo. Enlisting the short-term goals of management, first and foremost, we need to talk about the patient education, followed by ways to decrease the pain, followed by ways to decrease the edema, followed by improving the soft tissue mobility and joint range of motion, and also improve the soft tissue control and strength. So as we are discussing overuse syndrome, we know that the person has performed certain repetitive movements which could have caused the pain, or the person has strained way too much than the muscle's capacity to hold it that has caused the pain. So definitely the first statement that you need to tell the patient is to avoid any form of repetitive movements of elbow, wrist and hand, like, wringing of clothes, kind of rolling the chapatis, all those kind of things which involve repetitive front and back movements or bending and straightening movements of the elbow, wrist and fingers. They have to be, you know, completely stopped or probably done with certain rest pauses, again depending on how acute the pain is. Secondly, very heavy lifting should be avoided for the time being as far as possible, or mechanization can be done where they can use machines to lift instead of actual manual lifting, if that is a possibility for the person. Second thing is they need to give a rest to the upper extremity whenever it is possible. They need to provide rest as well as do cold compresses, and they need to prescribe a brace which could be of this sort for joint protection, which kind of offloads the muscle and also kind of gives the glide to the joint and reduces the pain and protects the joint. So if there is a person who comes to you whose profession demands him or her to lift heavy weights, you can just correct the lifting mechanics for the person, wherein we ask them to squat from the knee rather than the back, keeping the load closer to the body. If it is very heavy, trying to use some mechanization, using the core muscles activation so that the spine is more stabilized, so a lot of load is not coming on the elbow, etc. Using both the extremities rather than just the dominant hand. All these things can be explained to the person for safe lifting mechanisms while they are doing things at work. So immobilization using the brace not only helps in reducing pain but also provides the optimal rest to the part so that the inflammation can subside and the part can be rejuvenated. You, along with that, you need to do some amount of cryotherapy, which is ice compresses. So not just keeping just an ice bag over there, but you also need to ask them that occasionally, if it is possible, they should take ice cubes and towel, and then they should do circular motion around the lateral epicondyle if it is tennis elbow, or the medial epicondyle if it is the golfer's elbow, whatever the case is. Not only will it help with Lewis Hunting reaction with alternate vasoconstriction, vasodilatation that improves blood supply, but it also helps in numbing the signals going from nociceptors, because that movement that you're generating around the joint with the help of the ice cube also activates the mechanoceptors that helps in reducing the pain by pain gate mechanisms. Also, if the pain is not very super acute, that means it's not increased just yesterday or something like that, within the 24 hours period, you can check for myofascial trigger points, which will definitely be present on the extensor muscles in case of tennis elbow and the flexor muscles in case of golfer's elbow. And you can just release those, not only the extensor and flexor muscles, you can also check for biceps and triceps and overall shoulder girdle also to check if there are any tightnesses, and they can be released, which will definitely not just reduce the pain and edema but also help in improving the mechanics of movement around the joint. You can also ensure that cross friction massage is done along the respective epicondyle just to loosen out if there is any adhesions that are formed around the tendons wherever there is the origin. One can also do an ultrasound therapy. So if it is very acute, you go for more pulsed modes and a lower intensity. Whereas if you have a more chronic case coming to you, you can go for a continuous mode and a higher intensity for a longer duration. Along with that, taping can be done. Now, taping basically functions, usually kinesio tapes are preferred because it allows you to do the movement. So you can use either the glide technique where we are giving a glide to the radius in case of the lateral epicondyle, or to the ulna in case of the medial epicondylitis, or you can use the offload technique. So whichever muscles you feel has overworked and has gone into fatigue, which is causing to the pain, they can be offloaded or they can be inhibited, while the other weaker muscles can be facilitated. So you can use any of the taping methods, which will not only reduce pain but again help in allowing the movement over the joint. There are also certain tapes which can be applied to reduce the swelling around the joint. Even those taping methods can be employed over here. One of the recent electrotherapeutic equipments which is extracorporeal shockwave therapy can be included in your answers, because this particular therapy is very novice and definitely works very well with tendon injuries, like in the case of epicondylitis of either lateral or medial type. So you can give about 1500 to 3000 shocks in a session. The sessions usually come in a gap of 3 days or a week based on how you cannot definitely do this in very acute cases, because this itself probably leads to some amount of soreness for most patients. And you just need to do about 3 to 5 sessions of this along the origins of the tendons or along the muscle belly, as the case may be in your particular patient. But it is good to mention about extracorporeal shockwave therapy in your answers, because this has definitely shown good results in eccentric loaded muscle injuries, like in the case of tennis or golfer's elbow. So not only will you use myofascial release as a way to improve the mobility of soft tissues around the joints, but you'll also have to add some amount of self-stretching techniques, not just for wrist and flexors and extensors, but also for your elbow flexors and extensors. So this will help in improving your joint mobility and the cross bridges across the muscles. Any kind of adhesions that are formed, it will help in releasing those. So the dosage is definitely, you can give 10 counts hold for 5 repetitions, which can be increased to 10 repetitions. You have to take care that while you're giving stretches to the joints, you do not suddenly release the stretches. Do not give any kind of ballistic stretching at this point in time in the short term sessions, or sessions which you have done while the person is having some kind of pain. And make sure that the stretch that you're giving, the intensity is tolerated by the patient. It should not be overstretched as well as understretched. So you need to understand how to give the stretching techniques accordingly based on the stage of tissue healing. There may be associated positional faults in the joints because of this constant overuse in the muscles, whether it is tennis elbow or golfer's elbow. It can be corrected with the help of movement with mobilization, which is your Mulligan's technique. You can give 10 repetitions. Once you understand the right glide which you have chosen for the person, you can give 10 repetitions in one set, and like that you can do 3 sets in a particular session. That will not only help in reducing the pain, but it also improves the range of motion with its mechanical and neurophysiological properties. So you obviously have to strengthen the muscle gradually. So your first step in the short-term goal would be strengthening using isometric exercises in a particular position. And later on, you can progress that to multiple angle isometric exercises. And you can give resisted isometrics also later. So you then later can go to dynamic exercises, first using against gravity method and later using free weights. And you have to make sure that, because these are eccentric injuries basically, because you have loaded the muscle eccentrically multiple times with repetitive movements, you need to make sure your strength training not only does a good concentric training, but also a good amount of eccentric training on the muscles. So in the long term, you must ensure that you are working on the entire upper extremity, improving the neuromuscular control and coordination, because as you know that your distal extremities function better when your proximal muscle strength and control is also good. So you need to work on the proximal as well as the distal muscles. At the same time, you need to ensure that you start with some weight bearing or proprioceptive training, so that that load is coming on the joints and the right neural mechanisms start working, which improve the or facilitate the whole neural system, as well as improve the proprioceptive feedback given to the joints. Moreover, if the person has returned to work or sport based on whatever the person's occupation is, you need to train the person accordingly and make sure that he is or she is fit to go back to their work. At the same time, you can also introduce some amount of high intensity plyometric exercises, like giving them bouncing of a tennis ball using a short handled racket, later a long handled racket, and chest presses, etc. So that later when they're subjected to any kind of repetitive movements or lifting, etc., or playing techniques also, if they are into any kind of sports, they do not re-injure back and come back with another episode of golfers or tennis elbow, as the case may be. Just before I conclude, I would like to mention that most of the times, apart from subjecting the joints to such heavy repetitive activities, tennis and golfers elbow can also occur in people who are inherently in a lot of stress or worried too much, because that affects the fascia and the facial network across the body, and that facial tightness will eventually be reflected on the muscles and the tendons as well. So I think we also need to work well on the fascia of the muscles, also provide them with relaxation techniques apart from stretching and strengthening techniques that are there, so that the person does not have mental stress that can increase the tightnesses in the muscles. So these are the references which you can refer to while writing the answers. And just to summarize as to what we need to write in our answers, we need to ensure that we have a systematic flow chart for short-term and long-term goals. And each short-term or long-term goal is explained along with the dosage and rationale of why we are going to give a particular movement or exercise. Preferably draw diagrams, like if you're showing taping or something like that, you can just show where exactly and how you will be taping. And you can write points which are a little novice, as we have discussed a few new things apart from whatever conventionally is mentioned in your textbooks, and it would be nice if you are able to share the recent advances. So that's all for this particular video. If there are any doubts, you can feel free to comment in the comment boxes, and I will try and answer them subsequently whenever time permits. Thank you so much for watching.